Hello, this is Dr. Arun Panda, and today what I am going to do is I'm going to show you how to harvest the grafts from the beard area. See, what happens many a times, we are short of grafts from the permanent donor zone, that is from the occipital area. Um, in cases of androgenetic alopecia, wherein we know that it's a progressive disorder and that we know that even if there is a small tuft of hair which is there in the middle part of the scalp, we're going to lose it. So it's always better that we salvage some amount of graft in the permanent donor zone, that is the 2.5 inches area in the occipital part of the scalp, wherein we know that when we kind of redistribute the hair from the back and to the front, the grafts there, they retain their memory. So they don't lose their memory, and they know that they're resistant to DHT, and when they are transferred here, they sustain those DHT effects of DHT and they stay there. But many times what happens is we don't want to use much of the grafts from the donor area, that is the PDG, and that's why we kind of try and harvest some grafts from the beard area. Now the area which we are looking at from the harvesting is just below the jawline. So this is my jawline, so I can palpate and I can feel the jawline. This is my jawline, so I'm going to be palpating, and what I will do is I just mark an area just above the thyroid cartilage here. Just above the thyroid cartilage is where I'm going to mark. In the same way, I'm going to be marking it here, and this is my area. This patient, the beard is not that dense, but many of the patients, what happens is the beard is very dense, and in fact we get very good harvest from here. Of course, whatever is there, we can harvest it from here. The advantage of using the beard is that this follicles or this graft are very thick, almost the double of that which we use it from the permanent donor zone. That's why it's of prime importance that we combine this with the permanent donor zone grafts. Now, can we use this for the hairline? No, we should not be using it for the hairline, because the texture of this doesn't match the texture of your follicles which are supposed to be grafted onto the hairline. So we mix them beyond the defined zone so that it gives a good density because of the thickness. We can combine it and then it gives a very good thickness, almost the double the thickness of the graft. Now we know that the sensory nerve supply to this is basically from the transverse cervical C2 C3, but then since we do not have any proper anatomical landmark to kind of hit on the transverse cervical C2 C3, so what we're going to be doing is basically anesthetizing the skin here by giving a local infiltration. Okay, so the transverse cervical C2 C3 comes from here like this. So the question is, are we supposed to be giving a tumescent after the local anesthesia? No, because there is no hard structure beyond it. So giving a tumescent is not going to help us in any ways. So what we do is basically, as I said, we would be giving an infiltration there, and then we will be using this areas to graft. Okay, so what we do is basically, as I was telling you, once we have done this, so we just go underneath and we kind of infiltrate this area. Okay, in the same way we will be infiltrating this area. So we are going to be infiltrating the whole area, and trust me, this area heals very well. It doesn't leave any scar whatsoever, right? It doesn't. So the only problem in harvesting from the beard is that the direction of the follicles. So the direction of the follicles are totally haywire here. I mean, one follicle goes here, the other direction is here. So in every area you will have to keep on changing the direction, and you have to be very slow in kind of harvesting. You have to be very cautious, but most of the times we get a very good harvest here. Alright, so now we are going to be waiting for 30 seconds, and by the time I'll give my magnification please, and we are all set here. Magnification please. Alright, so what we are going to be doing is we are going to be using a 0.8 mm punch. So the 0.8 mm punch is, yeah, thank you. Okay, so we will be using a 0.8 mm punch here, and if you can come closer, I'm just going to show you how the direction of the follicles keeps changing. Come closer. So if you see here, the follicles are down like this, and then the follicle direction changes, and then it changes like this, and then it changes. It becomes very acute, and it's almost like parallel to the lower border of the jaw. So every time you're doing it, you have to keep on changing the direction of your punch. So I'm going to be using a 0.8 mm punch here. I'm going to be using a 0.8 mm punch here, and the first thing is basically we have to stretch the skin out here. And what I'm going to be doing here is, so if you can see the direction, my direction of the punch is changing every time. Alright, now what I will do is, I've done about 5 to 7, so I will use this and try and extract this. My direction is right. I'm not doing the transactions. Alright, now I've done out 5, 7 punches. So come closer, I will just show you how thick this grafts are. If you see, oh, this is a good, a follicular unit 2, follicular. Most of them are single, and if you see here, they are pretty thick. So it's almost the, okay, if I want to compare this with the thickness of the great. So if you try and compare this, great. So if you try and compare this with the thickness of the follicular units or the grafts from the donor zone, that's enough. See, compare this, how thick they are, almost the double the thickness. So imagine 2 follicular units is going to give you the thickness of a single graft here from the beard. You can actually see and appreciate this. So that's the advantage which we have when we are actually, so what we will be doing it, we are going to take this and put it in the same RL solution at a temperature controlled RL bath, and we will mix it at a later stage. And what we will do is, once we mix it, and we are going to be putting it. So what I have done here is, yesterday we have covered a small area, quite a good area of about 1700 follicular units to cover the frontal part. Now what we are going to be doing is harvesting, and we have today harvested about 1600 folliculars from the permanent donor zone, and we'll be using as much as grafts which we can get from here. So the same way what I will be doing is, so I'll have to keep on changing my direction, that is very important. So angle and direction keeps on changing. So if you see my handpiece, every time the direction is changing. If I don't do this, I'll be causing a lot of transaction. So that is what is important for us to understand. So as I'm going laterally, if you see, it's becoming more and more. I stretch it. Okay, and then, wow, nice and thick, nice and thick. It's nice. So if you see here again, very thick follicles, very thick grafts. One more person, just help me out in this. Yeah. So just hold this up a bit. I won't touch. Okay, now another thing which you should know is, try and compare this and this. Now why does this look like this and why does this look like this? That's because this is actually a white hair. If you see the whole thing inside, it's all white and these are all black. So ideally what happens is, if you see a white hair, you got to dye the shaft with dye, and then you do it, otherwise you can't appreciate. So this is a white thing and this is a black hair. Alright, and the same way, these are all nice double units, doubles, singles. Yeah, so this is almost the double the thickness. It gives us very nice it gives very nice density, and we can really appreciate it. Okay. So after we are done here, what we will do is basically we will be using a nice bandage with povidone iodine, and we pack it. It heals very well, and within 7 days you don't even see anything that has been performed from here. So as I said, we perform hair transplant using the beard very often. Most of the times we combine it. Many a times we combine it, and that gives us excellent results. So you want to understand more about it, please get in touch with us and we'll be able to help you out.